Foreskin Piercings. Pros, cons, advantages, disadvantages. Going to go through all 5 of each of those. Also, we're going to talk about, or I'm going to talk about, preparing to get the piercing done, things you should know beforehand, getting the piercing done, healing the piercing, jewelry, living with the piercing, and what happens if you don't want it anymore. Coming up next on Pros and Cons by Piercer, Season 2, Episode number 83. For those who are new to the channel, welcome to the Body Piercing and Tattooing channel. Hope you're enjoying the videos. Hope you're finding them helpful and useful, but you might not know who I am. My name is DaVo. I'm a professional body piercer and have been since 1994. I own and operate the Axiom Body Piercing Studio located right here in Des Moines, Iowa, inside Skin Kitchen Tattoo. Just a little quick disclaimer. If you are easily offended or do not want to learn anything about genital piercings, I'm gonna be talking about genital piercings. So this may not be the video for you. If it's not age appropriate for you or acceptable in your part of the world or something you just don't want to know about, there are plenty of other videos on our channel that have nothing to do with genital piercings. If you're here looking for something titillating and sexually exciting, you're going to be disappointed too. This is solely educational purposes. Basically for those that are considering getting the piercing done, maybe their partners, or those that are just curious about piercing in general. Just a short description, this piercing is done through the foreskin, usually straight through like this, done either with a ring, curved barbell, or even a straight barbell. Not really a lot of different options on this one. Now, this piercing has an extremely long history, first mentioned in the 1st century by a Greek medical writer by the name of, and I'm probably going to ruin this name, Oberius. He mentioned that people would get this piercing done and then put a 10 stud in it, which I can't imagine how good that 10 stud felt, and nobody had an allergic reaction. Anyway, and it's also been rumored, though I had a hard time finding something that definitely nailed down any type of source for this information, but it was used during Roman times. Their athletes would often compete completely naked, and it was used to help in tying the penis to the leg, or I think it's a leg, or was it to the scrotum? I can't remember, but to keep it from moving around and being really in the way. Also in Roman times, it supposedly was used as a form of infibulation, also known as chastity, that the done with 2 piercings or 3 piercings or 4 piercings and then connected together so that the person couldn't use that part of their anatomy. Whether that's true or not, we'll go into, I'll cover a little bit on chastity later on, but yeah, no, I don't think that's true, but it's been mentioned. Now let's get into the pros and advantages, the things that make you go, yes, I need that in my life. Starting with number 1, increases sexual sensitivity or sexual enjoyment. This varies from person to person. I always kind of put it this way. It may make it better. It's not going to make it worse, but it's definitely going to make it different. Number 2, quick healer. Any genital piercing, for the most part, will heal very quickly. This is a piercing that goes through a small, thin layer of tissue. It will heal out very, very quickly. It's an established piercing. As I mentioned earlier, it dates back, 1900 years plus. So chances are it's going to heal, and you can have it. It can be a lifetime piercing, something you have for the rest of your life if you want. Number 4, there's a lot of different placements. Options. This can be done in pretty much anywhere along the foreskin, all the way around. You can do it at the top, the bottom, the sides, at an angle, what have you. It's what you want and what you want to experience that these can be done at. And the last one, number 5, easy to hide or conceal. This is a piercing that if you live in a conservative area of the world or you work in a conservative industry, what have you, it's a piercing you can have and that only people that you trust enough to be intimate with or tell will know that you have this piercing. It's not like a nostril piercing or an eyebrow piercing or an ear piercing where everybody sees it. This is solely your little secret if you want it to be. Now let's move on to the cons. The disadvantages, the things that make you say no, I can do without that. Starting with number 1, anatomy. Anatomy is important with this one because, at least in the United States, circumcision was very popular and still continues to be popular for no apparent reason. If you don't have the foreskin, you can't get this piercing. It's as easy as that. So you do have to be uncut. Number 2, bleeding. These can bleed a little bit off and on for about 3 to 5 days in some cases. Precautions have to be made to make sure that it doesn't stain clothing, bedding, etc. And I'll get into that more when we get into healing. Number 4, some partners may not enjoy this piercing or refuse to have fun with you without removing the jewelry. It's important always to discuss this, especially if you're in a committed relationship or have a long-term partner or partner you want to keep, that you kind of test the waters on this, on whether or not that's something they're okay with. Number 5, it's going to increase your likelihood or risk for STDs and STIs. You have a hard piece of metal through soft tissue. There's a possibility of tearing during rigorous activities, and there can cause a slight tear and then exchange of a virus causing an STD or even a microorganism, any other microorganism getting in there and causing an infection. So you basically have to practice safe sex until you've both been tested and cleared and everything else. Now let's talk about preparing for the piercing. The first thing is find a piercer that's well experienced, skilled, has done a number of these piercings, and is confident with doing this piercing. It is kind of a bit on the specialty side with certain. It depends on the part of the country. It depends on the population, etc. Some people are a lot more experienced with it because they've had more options to do this particular piercing than other people. They should make you feel comfortable and at ease. They should also be willing to answer any questions you have, give you a consultation on the piercings, what it's going to take to heal it, risks involved, etc. Before they do the piercing, and answer any questions you may have. Also, they should go through, when it comes to aftercare, they should provide written instructions and also go through it verbally with you. This needs to be done with either a ring, which is probably the most common, circular jewelry, like a curved or circular barbell, curved barbells, or a straight stud. They should have these in stock. They shouldn't be suggesting other types of jewelry. The piercing may bleed off and on for up to 5 days. It varies from person to person. We try to kind of check out the anatomy and avoid blood vessels, but every once in a while we just hit one, or get close to one, and then you see more bleeding. You need to be prepared for that. Sanitary napkins, pads, puppy pads, all those things, and I'll go into them a little bit more in detail later, will help you keep from staining clothing, bedding, and etc. Cross-contamination prevention. You are going to have some changes in your daily habits, and I'll go into those when we go into healing. I'll cover them in depth, a little bit more in depth, but it is going to take some changes in your life to heal this piercing out without risking infection. Last thing is on preparing is ask your piercer whether or not they supply aftercare product. In most cases, it's going to be Neomed's Piercing Aftercare, a sterile saline in a can, or can they point you in the right direction to pick up and purchase that in advance so you don't have to run around and look for it the day after or the day you got pierced. Now let's move on to the piercing experience itself. First thing that happens is you have a verbal consultation with the piercer. They are probably going to check your anatomy at that point in time, answer any questions you have, etc. Then we're going to pick out jewelry, what's going to work size-wise, type, material, etc. In this day and age, in most cases, that's going to be a titanium piece just for durability and biocompatibility. Then you're going to fill out a waiver. Waiver's going to ask questions about your health, medication, intoxicated state, etc. Anything that may impede or impair or cause problems during the during the piercing or after the piercing. Be honest about this. If you have a medical condition that may cause issues, talk to your piercer about it, discuss it. If they don't have the right answer or aren't clear about it, check with your medical provider to find out for sure. Once the waiver is signed, we go ahead and start setup, get all our tools out on a clean field. Then we will disinfect the area and mark it. When marking this, generally I'm more concerned with position. Sometimes I'll mark both inside and outside. It varies from what's doing. And I will retract the tissue to make sure that there is enough room for that jewelry when the person is erect, because the distance between the 2 points, it changes. Once it's marked, then I prefer to do these with clamps, just basically to make sure that the only tissue that I have is the tissue we're piercing and nothing else. A hypodermic needle is injected in and through. Then we remove the clamps. The needle, if we're doing this with rings, the needle's pushed out with the jewelry, with the ring. If we're doing this with threaded jewelry, usually I'll use a guide pin. Basically, we'll push the needle out with that and the jewelry in, and then all that's left is closing the jewelry and stopping any bleeding that's going to occur. There might be a little bit of slight or moderate bleeding that we'll need to stop at that point in time and clean up. Usually you'll have a little bit of discomfort with contact. General piercings tend to be this, oh, God, that hurts, and then it's over. It's very intense, but then that endorphin rush and everything else hits really quickly, and before long, you're not even feeling it. Of course, when you nudge it or move it or the jewelry gets shifted or what have you, you might notice discomfort, and that can last up to about a week afterwards. But for the most part, you're not even going to notice you have it. Now let's talk about healing. Average healing time on this is anywhere from 6 to 8 weeks. I generally suggest, because most people are sexually active, to treat it like a healing piercing for 3 months just to be on the safe side. What that's going to involve is cleaning twice daily using a sterile saline spray. When getting spray, there's a couple things you want to look for. It should be in a metal can that is under pressure. It should say somewhere on the packaging, sterile. When you turn it over and look on the back, it should say under ingredients, purified water and sodium chloride. Nothing else. As far as the delivery, there's various different nozzles. The most ideal is the mist nozzle. You just spray it directly on there and leave it alone. Some of them come out like squirt guns, like a super sucker. Those you may want to consider doing a compress, a cold compress, using a sterile piece of gauze sponge and saturating it and then laying it against the area. In a pinch, you can't get away with a clean paper towel, but I like the sterile gauze sponge better. Swelling on these can last a couple days. 3 to 5 is usually a good average, usually not that long. They have a good recovery in most cases. Cross-contamination prevention, most of this is common sense stuff. Wash your hands before you handle it. No oral contact or exchange of bodily fluids on, near, around the piercing for a minimum of 6 months. That doesn't mean you can't have sex for 6 months. It just means that you need to use a latex barrier. With this piercing, I really suggest large reservoir condoms, the ones that are kind of more ballooned at the tip. Also stay away from anything that's super tight or ribbed, because those can be very uncomfortable with how they make the jewelry sit. Keep your environment clean. Clothing, bedding, towels, anything that may come in contact with the piercing needs to be cleaned on a regular basis. Other things you want to worry about during sexual activity is make sure that if you are using a water-based lubricant, that it doesn't have any additives in it. Do not use anything that's petroleum-based. If it has warming gel, spermicide, any of that stuff, stay away from it. Keep your environment clean. Clothing, bedding, towels, anything that may come in contact with this piercing needs to be cleaned on a regular basis. No swimming. Do not submerge piercing in bodies of water you cannot control the quality of, which is pretty much everything but your own clean bathtub. I don't care how well it's maintained or whether or not it's private or only 2 people swim in it. If it is a body of water large enough for you to submerge your whole body in and move around, it is full of microorganisms. You have an open wound. Microorganisms could get into that wound and cause an infection. So stay out of the water until it's healed. Keep pets away. People look at me odd when I say that. What I'm mainly concerned about is keep them out of the bed, keep them away from any clothing that may come in contact with the area or bedding or anything. They're going to have to be a little bit, out of the bed, maybe out of the bedroom. Last one, wipe front to back. I know we all supposedly do that, but it seems like a lot of people with penises don't. So it's important you do that because we don't want to drag any of that fecal matter onto the area and cause an infection. Avoid playing with a piercing or excessive movement. For the first 3 to 5 days, as I mentioned, you are going to probably experience a little bit of bleeding off and on. I generally suggest wearing a sanitary napkin or pad during that period of time. Also, when sleeping, go hit a dollar store or department store and buy some puppy pads. And then just sleep with those underneath the area. This will cut down the likelihood of, if the pad leaks or what have you, or you bleed a lot throughout the night, of it staining your mattress and sheets and everything else. And it's a cheap alternative. You can usually get like a big pack for a couple bucks. Avoid trauma in contact with a piercing. If it hurts to do something, don't do it. When starting to do sexual activity, gentle at first. If it hurts to do something, take a rest until it doesn't, or try something else. Over time, that'll go away. It's not a permanent thing. Just be patient. Now let's talk about jewelry. Jewelry should be left in at all times. If it's threaded jewelry, you need to check the ends on a regular basis. I usually suggest doing it weekly, like pick a day of the week, and then it's ball checking day, and just make sure they're all on tight. When picking jewelry, consider where this piercing's at, what it comes in contact with, and how you use it. Stay away from anything that has sharp points or edges on it. You want smooth ends to avoid possibility of getting caught on things, but also not feeling very good. As I mentioned earlier, I generally suggest, it really depends on the person and preference. Curved jewelry seems to feel a little bit more comfortable in this, either rings or curved barbells. Should be made of a certified biocompatible material, such as titanium. Is your best bet, probably. Niobium would be another option. If you've never had problems with nickel, then surgical stainless steel, and also 14 karat nickel-free gold is a good option too. Finish should be high quality. We want the minimum amount of issues. The more you spend on jewelry, generally the better outcome's going to be. Some people will find larger or thicker gauge jewelry a little bit more comfortable. You can stretch these piercings. You just need to give it enough of a break between stretching to give your body time to grow and strengthen that piercing. Also, if you have a medical emergency or a medical procedure where they're requiring you to remove all jewelry, you can wear glass jewelry in these piercings. However, they're not very comfortable or very secure, but it will keep the piercing open while you're doing that. Living with a piercing. Check the balls on a regular basis. I know I say this a lot of times, but it's really probably one of the most common reasons people lose piercings. So make sure they're on there tight. Avoid contact with the jewelry even after the piercing is healed. Make sure that's not getting caught on things. Make sure the clothing you're wearing is not readily going to get caught on it all the time. Leave jewelry in at all times. I don't really suggest leaving it out for periods of time. These can be a forever piercing in some cases, but you can never be guaranteed that's going to be the case. Now I'm going to talk about chastity and infibulation. This has been commonly used in BDSM play as a form of chastity. The problem is that as the penis becomes erect, it can actually tear the piercing. So I don't really suggest doing it for long periods of time or using it as a sole purpose kind of situation. It's kind of more for the fun of it than actually the practicality of it. It's not always going to work. You want to make sure that the piercing is well seasoned and healed before you even consider this, and understand that this can cause damage to the piercing. If you start to notice discomfort, that jewelry needs to be disconnected immediately. Generally, the way they do this is just locking the two rings together. And to finish things out, let's talk about abandoning the piercing. If you have the piercing, and either during the healing process or after the healing process, and you've just decided you don't want the piercing and it's healthy, there's no signs of infection or other problem, removing the jewelry shouldn't be an issue. It will close up just like any other wound. Just keep an eye on it, especially if it was during the healing process. Treat it like any other wound you would on your body. If there's any signs of infection, contact medical professionals. If there is an issue with the piercing, contact your piercer, have them take a look at it, and let them decide whether or not it's safe to remove the jewelry or not. Or go to your medical professional. The reason why is we don't want to create a situation where the infection may be trapped inside there if you have an infection. And the easiest way to explain this is how bodies heal infection. They trap that infected tissue and fluids inside of kind of a ball or a cyst or called cyst or an abscess, and then slowly push it out through the wound, and then drain it. With puncture wounds, because especially longer ones, this one isn't quite as bad, but longer piercings are more prone to this issue where you take the jewelry out because it's infected and it gets trapped inside under the skin, and your body tries to force it out and it can't, so you have to go see a doctor and have it lanced and drained. To avoid that, whenever there's a problem, before you abandon the piercing, see your piercer or a medical professional just to make sure there aren't issues. Of course, even if it's healthy, if you just don't feel comfortable taking it out, see them and talk to them about it. Other thing is even an abandoned piercing can sometimes secrete what is called sebum. It is a waxy cottage cheese substance, has a very distinct odor to it. Your body produces it everywhere. It's used to oil hair follicles or lubricate hair follicles. Also, your body uses it to help keep you watertight or waterproof. Seeing it come out of piercings or squeezing it out of piercings isn't an issue. Just leave it alone. Your body, it'll clean off, and this will reduce over time the longer you have the piercing. Well, that's it. Do you have foreskin piercings? What was your experience like? Any advice you can give to other people considering it? Leave a comment. If I missed a question or you have a question about this, please leave a comment. I'll be happy to answer it. Till next time, here's hoping all your piercings heal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I would love to see you for your body piercing needs in the future. Have a good day, everybody. Take care, and we'll see you in the next video.